You've likely taken them together, two everyday medications found in every senior's bathroom cabinet, one for pain, one for protection. But what if I told you that this common pairing, recommended by well-meaning doctors, could trigger a cascade of events that lead straight to a heart attack? In this video, I'll uncover the hidden interaction between these two so-called safe drugs and reveal what every senior needs to know before swallowing another dose. You've likely been told that aspirin helps protect your heart, and on its own, it often does, especially after a heart attack or when prescribed for certain cardiovascular conditions. But here's where things get dangerously misleading. Many seniors, without a second thought, combine aspirin with over-the-counter painkillers like ibuprofen, naproxen, or diclofenac, drugs known as NSAIDs. It sounds innocent. One pill for the pain, one for prevention. But that combination, it can quietly unravel the very protection your heart depends on. Here's why. Aspirin works by thinning the blood, reducing clot formation. That's why doctors prescribe it to reduce stroke and heart attack risk. But NSAIDs, like ibuprofen, have a very different mechanism. They reduce inflammation by blocking certain enzymes, but they also reduce the protective effect of aspirin on platelets. That means when you take the two together, especially within a short window of time, the aspirin can stop doing its job, and your heart is left exposed. I've seen seniors who followed every rule, ate clean, walked daily, even monitored their blood pressure, come into my clinic confused and terrified. Their arteries were inflamed, their heart rhythm unstable, and in some cases their blood had clotted at a dangerous rate. The only common factor? They were taking NSAIDs and aspirin together, believing they were playing it safe. But the risk doesn't stop there. NSAIDs themselves raise blood pressure. They cause fluid retention, stress the kidneys, and constrict blood vessels. That's a toxic setup for an aging cardiovascular system. For a 30-year-old, the body might bounce back. For someone over 60, especially those with high blood pressure or existing heart disease, it's a perfect storm. One large study published in the BMJ followed over 7 million patients and found that taking NSAIDs, especially in combination with other medications, significantly raised the risk of heart attack, sometimes within the first week of use. Another report from the American Heart Association warned that even short-term use of NSAIDs can increase heart attack and stroke risk in vulnerable populations. And yet these pills are everywhere. You don't need a prescription. You don't need a warning. Just one minor ache and a bottle in the bathroom cabinet, and the damage begins silently. This is why it's critical, absolutely critical, that seniors don't self-medicate without understanding how these drugs interact. You must ask your doctor, not just if a medication is safe, but if it's safe with what you're already taking, because your heart isn't just reacting to one pill. It's responding to the whole chemical cocktail. Now, if combining aspirin and NSAIDs is this risky, what about other so-called safe pain relievers? Could Tylenol be the answer? Or is there a darker side to it too? When the risks of NSAIDs start to surface, many seniors are told, just switch to Tylenol. It seems like the safer option. After all, acetaminophen, sold under brand names like Tylenol or Panadol, doesn't thin your blood. It doesn't increase stomach bleeding like NSAIDs. It doesn't interfere with aspirin's effects on the heart. So, what could go wrong? Plenty. Here's the uncomfortable truth. Acetaminophen, while easier on your stomach, can quietly place massive strain on another critical organ, your liver. And after 60, your liver doesn't function the way it did at 30. Its ability to metabolize drugs slows, and when acetaminophen is taken regularly, especially in combination with other medications or alcohol, even recommended doses can begin to tip the scales toward liver toxicity. What most seniors don't realize is that acetaminophen is everywhere. It's in your cold medications, your flu remedies, your nighttime sleep aids. It hides behind different names like APAP or is buried in the fine print of combo drugs. That means many people accidentally double or triple dose themselves without realizing it. I've seen it happen. A patient comes in with fatigue, nausea, a yellow tint in their eyes. They're not heavy drinkers. They're not reckless. They were simply taking 2 or 3 medications that all contained acetaminophen. The liver enzymes tell the story. Damage is underway, but the risk doesn't stop there. Emerging research shows that chronic use of acetaminophen may subtly affect heart health too. A study from the University of Edinburgh found that long-term use of high-dose acetaminophen can raise blood pressure, especially in those already at risk of hypertension. And remember, even a small, consistent rise in blood pressure after 60 can be the final push toward heart failure or stroke. There's also growing concern about how acetaminophen interacts with the gut microbiome, indirectly influencing inflammation levels in the body. While not as dramatic as NSAIDs, it's a slow burn, a background stressor your heart doesn't need. But perhaps the most overlooked danger is false security. Because acetaminophen doesn't cause the same immediate side effects as NSAIDs, no stomach ulcers, no fluid retention, many seniors take more than they should. Some even stack it with NSAIDs, thinking it creates a perfect pain solution. I'll take Tylenol in the morning, Advil at night. What they've done is place their liver in one vice and their heart in another. Pain relief should never come at the cost of organ health. And for seniors, that cost rises every year. Your liver filters your medications. Your heart pumps through the pressure. Over time, this invisible workload builds, until one day it becomes visible in the form of chest tightness, fatigue, or worse, a collapse that no one saw coming. So if acetaminophen isn't the innocent option, what is? What should you actually take to manage chronic pain without risking your heart, liver, or life? Let's talk about that next. You take your pain pill. You take your blood pressure meds. Maybe a statin at night. All prescribed. All routine. But what your doctor didn't mention, and what most pharmacists assume you already know, is that when these medications interact, they can quietly push your body into dangerous territory, especially if you're over 60. Let's start with statins, the cholesterol-lowering drugs prescribed to millions of seniors every year. Drugs like atorvastatin, simvastatin, or rosuvastatin. They're effective at lowering LDL, or bad cholesterol, reducing plaque buildup in the arteries. But when combined with certain painkillers, particularly NSAIDs, the risk of serious side effects skyrockets. Here's how. Statins are metabolized in the liver, the same liver that processes acetaminophen and most other pain relievers. When too many liver-metabolized drugs are taken together, the liver becomes overwhelmed. Toxic byproducts build up. The result? Muscle damage, liver inflammation, and, in extreme cases, a condition called rhabdomyolysis, where your muscles begin to break down and release proteins into the bloodstream, potentially damaging your kidneys and triggering heart complications. But it doesn't stop at statins. Common blood pressure medications like ACE inhibitors or diuretics can also interact poorly with NSAIDs. This trio of NSAIDs, plus BP meds, plus statins, has a name in medical circles: the triple whammy, and for good reason. It can reduce kidney function dramatically, spike blood pressure, and throw off electrolyte balances, all of which place enormous strain on your heart. Imagine this scenario, which I've seen too many times. A senior is managing mild arthritis pain with ibuprofen. They're also taking lisinopril for blood pressure and simvastatin for cholesterol. Everything seems fine, until they begin to feel dizzy, then weak, then breathless. Labs reveal kidney stress, elevated muscle enzymes, and dangerously low sodium levels. Their heart, caught in the middle, is racing to compensate. The scary part? There were no obvious symptoms until things reached a crisis point. No alarms. just a slow, silent buildup of biochemical stress. One 2014 study in nephrology dialysis transplantation warned that even short-term use of NSAIDs in patients on BP meds and statins increased the risk of acute kidney injury by up to 31%. That's not a long-term side effect, that's a collapse waiting to happen within weeks. And yet, every day, this combination is happening in homes across the country because seniors often don't think of pain pills as serious drugs. They see them as household helpers, something to get through the day. But when paired with other prescriptions, they can turn your medication routine into a landmine path. And what's worse, many of these interactions are not caught in time, not because people are careless, but because the damage is internal, invisible, and accumulates quietly. So, if the triple whammy is putting seniors at risk, what about those who take supplements like fish oil, turmeric, or ginkgo for inflammation or brain health? Could those natural remedies be quietly worsening the storm? We'll cover that next, and what you learn might shock you. They sit quietly in your kitchen cabinet, neatly labeled, proudly boasting words like natural, organic, heart-healthy, supports brain health. You trust them. After all, they're not drugs. They're supplements: fish oil, ginkgo biloba, turmeric, garlic pills, magnesium. But here's the dangerous truth. For seniors already taking blood thinners, heart medications, or cholesterol drugs, some of these natural remedies are not safe at all. In fact, they can quietly multiply the effects of your prescription drugs, turning modest, controlled dosages into a biological free-for-all. Let's take fish oil, for example. Omega-3s are fantastic for heart health in the right context. They lower triglycerides, reduce inflammation, and support brain function. But for seniors on aspirin, warfarin, or any anticoagulants, fish oil becomes a wild card. It's a natural blood thinner. Combine it with prescription blood thinners, and suddenly, your blood is far more fragile than you intended. I've had patients arrive at the ER with unexplained bruising, nosebleeds, or internal bleeding, all while believing they were helping their hearts with a natural supplement. The truth is, fish oil can quietly increase bleeding risk, particularly in those already on medications that affect clotting. Now consider turmeric. Popular for joint pain and inflammation, it also acts as a blood thinner and can interfere with liver enzymes, potentially altering how your prescription medications are absorbed or broken down. Turmeric isn't just a spice. It's a pharmacological compound in disguise. The same goes for ginkgo biloba, often taken for memory support. It too has anticoagulant properties. Combine that with aspirin or a statin, and the result can be dangerous, even deadly, in the wrong dose or context. And let's not forget magnesium, often used to calm muscle cramps or improve sleep. It sounds harmless, but when combined with certain blood pressure medications or diuretics, it can trigger dangerously low blood pressure, dizziness, or irregular heartbeats. Again, no flashing warning signs, just a slow, creeping fatigue or faintness that can lead to a fall, a hospital stay, or worse. The problem here isn't intent, it's misinformation. Seniors aren't taking these supplements to be reckless, they're doing it to feel better. But in a body over 60, one that's already juggling a complex web of medications and biological changes, even natural compounds can behave like pharmaceutical-grade drugs. And when these mix behind the scenes, the effects are amplified, unpredictable, and often overlooked by both patients and doctors. Here's what every senior needs to understand. Natural doesn't mean harmless, and over-the-counter doesn't mean safe. Supplements may not require a prescription, but they absolutely require caution. That's why it's vital to tell your doctor about every supplement you take, even if it's just a vitamin. Even something as innocent as vitamin E in high doses can increase bleeding risk. So if you're trying to do everything right, eat clean, take your meds, support your body naturally, but you're still feeling off, tired, or unusually bruised. It may not be aging. It may be a chemical war going on inside you that you never even knew you triggered. But what if you've already been mixing these pills, prescriptions, and powders for years? What can you do now to protect your heart, your organs, and your future? That's exactly what we'll cover next. You might be wondering, what if I've already been doing this? What if I've taken NSAIDs with aspirin or combined fish oil with blood thinners? Is the damage already done? The answer, thankfully, is no. In most cases, your heart, your liver, your kidneys, they're more resilient than you think, but only if you give them a chance to recover now, not months from now. Because in your 60s, 70s, or 80s, every week counts. The first step? Clarity. You need to get brutally honest with your medicine cabinet. Make a complete list, not just prescriptions, but every over-the-counter pill, vitamin, herbal tea, oil, and powder you're using regularly. Then bring it to your doctor, not your assumption, not what you remember, the actual list. This alone has helped thousands of seniors avoid fatal combinations just by letting their physician see the full picture. But clarity isn't just about what you're taking. It's also about why you're taking it. Ask yourself, am I still taking this because I need it, or because I've always taken it? Has my pain improved? Or am I just masking it every day without asking deeper questions? Too often seniors build a medical routine that never evolves, even though their bodies do. What worked at 55 may no longer serve you at 75. Medications must adapt as your body changes, and that's where most problems begin. So, start with your list. Review it often and ask your doctor, do I still need this? Is this combination still safe for me? Next, focus on hydration and detoxification. No, not trendy juice cleanses. Real biological detox, powered by water, fiber, and clean food. Your liver processes every chemical you ingest, and your kidneys filter the byproducts. But these organs can't perform if you're dehydrated or overloaded with sugar, alcohol, or processed food. A single week of cleaner eating, fruits, vegetables, whole grains, beans, and lean protein, can dramatically lower inflammation markers and give your system space to recover. Also, don't underestimate the healing power of movement. No, we're not talking about marathons or lifting weights, but regular, low-impact activity, like walking, light stretching, tai chi, or even gardening, improves blood flow, supports kidney function, and helps regulate blood pressure. Motion is medicine for your heart. Finally, ask your doctor about medication timing and spacing. Many dangerous drug interactions happen not just because of the combination, but because the drugs were taken too close together. Taking aspirin and ibuprofen within an hour of each other is a perfect example. A small adjustment in timing can restore the protective effects of one while reducing the risks of the other. And here's the good news. Studies have shown that seniors who actively manage their medication routines versus passively following instructions live longer and with better quality of life. The moment you take control, you reduce your risk of emergency hospital visits, cardiac episodes, and drug complications. You don't have to be a doctor. You don't need a medical degree. You just need awareness and action. But before we wrap up, there's one final silent danger we haven't yet addressed, one so overlooked it doesn't come in a bottle. It doesn't have a warning label. And yet, for many seniors, it's the most damaging heart habit of all. Let's talk about that next. You've heard about the pills, the interactions, the so-called safe remedies that can backfire inside an aging body. But there's one more danger, one that never shows up on a prescription label, never gets mentioned in TV commercials, and can't be found in your medicine cabinet. It's assumption. The assumption that if it's sold over the counter, it's harmless. The assumption that if you've always done it this way, it must still be working. The assumption that your doctor knows everything you're taking, or how it all fits together. That quiet, unquestioned belief? It's more dangerous than aspirin and ibuprofen combined, because it's what leads you to pop 2 pills before breakfast without thinking. It's what keeps you from asking questions during appointments. It's what silences your inner warning system when something feels off. I've watched assumption cause strokes. I've watched it lead to hospital beds, kidney failure, collapsed hearts. And I've watched it break families, not because someone was reckless, but because they trusted the routine more than their own body. But here's what I also know. Assumption has an antidote, and it's called awareness. When you start questioning what's in your body, when you get curious about the why, not just the what, that's when everything changes. It's not too late to rethink. It's not too late to restart. It's not too late to save your heart from a storm it never deserved. Because the deadliest health choices aren't always about what you take. Sometimes they're about what you ignore. So before you reach for that next safe pain pill, ask yourself, do I really know what happens when it meets everything else I'm already taking? And if the answer is even a little uncertain, that's exactly where healing begins.